Welcome to Clyde Ellis Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Clyde Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Dr. Vijay Iyer is the Medical Director for Cardiovascular Services at Kaleida Health. Welcome, Doc. Thanks for joining us today on Medically Speaking.
Thank you, Mike. Thanks for having me.
So I know this is a pretty stressful time for the community when it comes to their healthcare needs, and in your world, talking about cardiac services. Before we get into COVID-19, if you can, tell us a little bit about how things are going in your world from the cardiac division. Hospitals may have canceled elective surgeries and all, but overall, we're still seeing cardiac procedures come through.
We are. The volumes are down significantly. We are currently not performing any elective procedures. And by elective, our definition is if we feel that a patient can safely wait for 6 to 8 weeks, we are waiting. But we are also constantly triaging and are in communication with our patients. So those that we feel are not safe waiting for any duration of time, we are doing those procedures. And obviously, we are taking care of any acute emergencies that come into the hospital.
So then if you move into COVID-19 and the risk that presents there, can you tell us a little bit about how people may be in a little bit of a risk category for that?
So we can think about it two different ways. When we think about patients who have cardiovascular problems and COVID, there are two sort of manifestations. One, people who have pre-existing cardiovascular disease, whether it be hypertension, coronary artery disease, those individuals we are finding based upon studies from China, Italy, and Spain are at higher complications related to COVID infections. And the reasons for these are not fully understood, but it is clear that the case fatality rate for people with cardiovascular disease is almost 10 times the average population. And this may simply be related to age of the patients because they may be older, but we do believe that there may be something more than just the age which may be playing a role in here. The second aspect of COVID and heart disease is that some patients with advanced COVID who have inflammatory changes are actually manifesting with cardiovascular manifestations, and that could be in the form of heart failure or myocarditis. Many patients who are presenting with symptoms that appear to be like an acute heart attack, but actually have inflamed muscle in their heart. So this is also something we are seeing with COVID.
So I want to go back a little bit and talk about the pre-existing conditions, because I think, a lot of the talk through the media over the last month or so has been about COVID-19 and how, it spread through droplets and all that. But when you talk about those who have pre-existing conditions, tell us a little bit about what those are in layman's terms. And so how people need to think about this, because it's not just, the droplet perspective, but the pre-existing condition notion.
That's correct. So we all believe that it's the immune response to the virus that is going to manifest or bring about the manifestations of the disease. So what we know is that for the average healthy population, for people who don't have any significant medical issues, even with COVID infection, the case fatality, that means that the chances that they are not going to survive if they get this infection is pretty small. It's probably to the order of 1% or lower. However, in those people who have pre-existing cardiac disease, that means you've had a heart attack or you have heart failure or you've had a heart transplant, those individuals seem to have a much higher chance of not surviving if they have COVID disease, or worse still, their manifestations may be more severe than the average population. As I said, the exact reasons for this are not well understood. The other population are people who have high blood pressure. Now, there are some interesting theories around about why high blood pressure may be a predisposing factor for worse outcomes, but none of it is proven yet. But these are the conditions. If people realize that they have these pre-existing conditions, it becomes extremely important for them to be even more careful with the precautions that they need to take. And that means hand washing frequently, making sure that they're socially distancing themselves, and maybe even socially isolating themselves if they are in this high-risk vulnerable population. And absolutely making sure that they're doing all the other things that the CDC is recommending, including wearing a mask, washing their hands, etc.
So we're not trying to cause panic or fear here. It's just more of an education and making sure those that may have a cardiac condition, pre-existing conditions.
You're absolutely right. The idea is not to panic. The idea is to just be a little bit more aware and maybe take the few extra steps that you absolutely need to. I think we all already know that we all should be socially distancing. We all should be protecting ourselves. But for this population in particular, they need to be absolutely certain that they're following the guidelines that the CDC and the New York State Department of Health has put out.
So, Doc, let me ask you this. If someone is experiencing some sort of heart condition, some heart problems during this COVID-19 epidemic or pandemic, what should they do?
I think they should do what they would normally do, which is get in touch with their providers. We now, almost all the providers in our area are able to do telehealth visits and video visits. You can certainly get in touch with your primary care physicians as well. And then they can help you escalate that care to the next level, whether it be coming into the office or going into the hospital. But certainly your first source of contact should be your provider who knows you best.
Dr. Vijay Iyer is the Medical Director of Cardiovascular Services here at Kaleida Health. Doc, thanks for joining us today on Medically Speaking.
Thank you so much, Mike. Appreciate you having me.